13-year-old Jahai McMath is on life support after she went into the hospital for a routine procedure to get her tonsils removed. Now her family is asking for a second opinion on her condition. Today, a judge appointed a doctor from Stanford to conduct his own evaluation. Here is the backstory. Family members say after that routine surgery, the girl suffered severe blood loss and breathing problems before going into cardiac arrest. Doctors at the Children's Hospital in Oakland, California now say Jahai is brain dead and that they have no obligation to keep her on life support. But on Friday, a judge issued a court order that essentially forces them to keep her on a ventilator. Medical researchers say doctors perform nearly 700,000 tonsillectomies each year in the United States, mostly on children under the age of 15. Dr. Carol Ash joins us now. She's a general internist with Meridian Health. So how does someone go into the hospital for a tonsillectomy, very common procedure, and emerge from it apparently brain dead?
Yeah, it's a real tragedy, John. I mean, when I first heard the story, what you have to wonder about this particular individual, two things that I've heard from the news, that she had trouble breathing and there was excessive blood loss. And a child like this that has sleep apnea, or anyone that has sleep apnea, is at risk for these catastrophic outcomes. And that's why we now recommend every child or every adult going for surgery that the anesthesiologist or the surgeons ask simply, do you snore? And you do additional monitoring to avoid these catastrophic outcomes.
The hospital is saying, sorry, this is irreversible. There is no brain activity, no blood supply to the brain. She is, for intents and purposes, dead.
Right, John. 1% of deaths occur as a cause of brain death. And the most common cause, the heart stopping, is what we're familiar with. So most people, this is a very unusual, confusing circumstance.
Because her heart is still breathing. Her mother says, look, I can touch her. I can feel her body is still warm. She can't be dead.
That's right, John. It looks like they're asleep, but the brain is actually dead. When there's no blood flow to the brain, there's no brain activity, then you are dead, and that's how we define it. And so legally and medically, they can remove her from life support. And again, we keep people alive. Amazingly, the brain is the CEO, the commander-in-chief, and when the brain is gone, the control of the physiologic processes is lost, and ultimately her body will deteriorate and decline, and we're just artificially maintaining the breathing and the blood pressure and what looks like life with the technology and medications.
So if they were to take her off the life support, it would be all over in seconds.
It would be all over. But it's reasonable, John, for the family to ask for a second opinion, because there's times when our bedside exam can be flawed because of chronic pulmonary problems, such as sleep apnea, as this child has, or chronic COPD, where the CO2 or carbon dioxide is elevated, could flaw the tests or make them inaccurate, and you diagnose brain death when you don't have it. So you want to do more testing, cerebral blood flow, which looks at supply of blood to the brain, and brain activity.
Yeah, brain activity. So that's what they'll be doing, taking a look at whether there is any sign of life in this poor girl's brain?
Right, John. And once the diagnosis is properly made, there's never been a case of a patient returning for meaningful recovery. Never.
So, all right, so her family just has to wait for this second opinion, and if it comes back negative, what happens then?
Well, doctors legally are allowed to remove patients from life support when they're diagnosed as dead. But the problem is doctors usually don't. They try and work with the family because you have a tragic situation. You don't want to doubly traumatize the family or engage in these kinds of legal battles. Unfortunately, it doesn't always go so smoothly. And the families, again, when the patient looks, she went into the hospital well, and now you have a young child who for all purposes, is what they're saying brain dead. It's just tragic.
What a shock for that family. You can understand why they're having a hard time dealing with it.
Absolutely.
Dr. Carol Ash, thank you.
My pleasure.